Well, we want to get a perspective, a new perspective compared to other societies, but we are still focused on collaboration, cooperation, and we want to push research, especially for young investigators. And we want to open a forefront for foregut disease.
I would tell them, well, this is something new. This is something that's going to develop, and this is something that, if they're interested in foregut, in benign foregut diseases, they should join. Well, first point is it's fulfilling my expectations. Second point is I didn't organize it myself. It was a big group, really, including you. Remember Trzeźniewski? Remember Tapper speaks?
Yeah.
No, perfect time. Yes, I think we're very happy. Perfect start. We will continue.
Well, it's absolutely fabulous to see so many people here who share the common goal of collaboration between all the specialties involved in the treatment of benign foregut disease. I mean, to be honest, it's exceeded our expectations to have so many people here. We didn't think that was going to be possible given the COVID situation, and even more people online. So far it's been a success. I'm sure there'll be some technical problems going forward. I'm amazed if they're not. But I think so far everybody's having a great time, and we're really delighted. And most importantly, we look forward to seeing even more people, hopefully physically, in Belgrade next year.
Well, I came to Vienna to support the European Foregut Society. I think this is probably the most important initiative I've seen in regards to the treatment of foregut disease, to bring people together for a multidisciplinary approach to this disease, as well as to focus foregut as the specialty that it is. I do see the American Foregut Society and the European Foregut Societies as sister societies. I do think there is a need for regional societies in regards to the treatment of foregut disease, but I think they're intimately tied, and I think there's a lot of opportunities for us to collaborate to again push foregut as the specialty that it is.
So the point is that it is my sincere opinion that if EFS wants to evolve, it has to incorporate almost all the countries in Europe, because this is a European society. And the one thing that has been a problem for the last 10 or 15 years concerning all this international surgical association is that the small countries for Europe didn't actually participate enough, or were not in the possibility to participate in such a huge congresses. So by coming of EFS to Belgrade next year, we are going to broaden actually the vision for the smaller countries, not only in the Balkans, but also in the Eastern Europe, in the Mediterranean, and therefore send our message all over the Europe, and so all the centers could work on an equal basis or have enough of information to deal with.
So I was motivated by the surgeon in our group, being a gastroenterologist, to look at EFS, and I thought this actually is a great place for people to get together. Number one, work on neurogastromotility, coming from this side, and then the other side, coming from the surgeons, to combine the techniques that we nowadays use, both in obviously the benevolence of patients, and I think that this society really focuses on both surgical and gastro aspects to make sure that our patients in the future will get tailored treatments using the best techniques And just about talking of working together, here we actually discuss things, find out where we could work together in the future, and I think in the future collaboration will be much stronger due and thanks to EFS.
I think this is an excellent opportunity for exchange regarding really the cutting-edge upper GI medical and surgical topics, and I think this is really something that makes a big difference to other congresses like I attended lately. And the multidisciplinarity and also the participation of multiple colleagues from all different regions of Europe, which makes it really a very particular and special event for me.
It's an important initiative to have an EFS because it is important to have a community which takes care of the quality in upper GI surgery, which means better education, a scientific network which produces knowledge for better quality in upper GI.
I think there are two important roles for a new society like the EFS. One is the cooperation between gastroenterologists and also other subspecialties and GI surgeons. It's important to work together because these are diseases that cannot be separated in a gastrologic and a surgical field. There's one patient and we have to take care of him. Another thing is medical specialization is going on, and therefore it's about time to have a process of specialization for the upper GI field, because we here in Europe are a little behind, and so we have to pick up with the speed of medical scientific role and knowledge and follow that specialization.
Well, I think in the context of the European Foregut Society, I think it's really important that the scientific and educational disciplines that contribute to care of patients with foregut disease work together. So we need to have surgeons and medical gastroenterologists, we need to have GI physiologists, we need to have clinical trialists working together, we need to work with the medical pharmaceutical industry and with the device industry, because getting all these forces together will help to gain new treatments, new understanding of disease, and improve the care that we give our patients.
I think that basically it's good to have European society and European dedicated to society, such as to get a glance at Eastern Europe, the South Europe, the Balkans region and so on, and to get people to share their experiences in the treatment of foregut diseases.
I think it's very important to combine surgeons and gastrologists, especially in benign foregut disease, and that's why I think this conference is really great to bring the disciplines together and talk about those important topics.
to Vienna and share our foundation of collaboration across disciplines. I think it's wonderful that we can collaborate across the world with other societies and raise them up and see their success.